Gonococcal urethritis. Neisseria gonorrhoeae, it is a non-capsulated gram-negative kidney-shaped diplococcus. It causes gonorrhea, which is a sexually transmitted infection which commonly manifests as cervicitis, urethritis, and conjunctivitis. So, Neisseria gonorrhoeae causes a STI that is known as gonorrhea, and it manifests as cervicitis, urethritis, and conjunctivitis. Neisseria gonorrhoeae is a gram negative, non capsulated, kidney shaped diplococcus. The laboratory diagnosis of gonorrhea specimen collection, it is different for men and women. For men, urethral swab is the preferred specimen, and for women, cervical swab. The endocervical swab for women is the preferred specimen, and for man, it is urethral swab. And Dacron and Rayon swabs are preferred. Cotton swabs are not preferred. Why? Because cotton and alginate swabs, they are inhibitory to gonococci. And for chronic urethritis where the discharge is minimal, in that case we need to do prostatic massage to collect the secretion. For transport media, see the specimen that is urethral swab or endocervical swab, it should be transported immediately. But if immediate transportation is not possible, then we should use charcoal coated swab and keep it in Stewart's transport medium. And the alternative to Stewart's transport medium is Amies medium. Amies medium is a charcoal containing medium. Okay, so transport medium we need to use Stewart's transport, and the swab should be charcoal coated. Then microscopy में we perform the gram staining. Gram staining में we will see gram negative intracellular kidney shaped diplococcus. So this is what we will see. Gram negative, that is red and pink in color, diplococcus, and kidney shaped. So this is the gram microscopy of gonococcus. Kidney shaped diplococci which are gram negative. For men, gram staining is highly specific and sensitive, but for females, it is only 50% sensitive. So, for female, culture is recommended for the diagnosis. Men के लिए gonorrhea infection में gram staining is highly specific and sensitive, but in case of women, culture is recommended. Why? Because of the presence of commensal Neisseria species. So, for culture, in case of women, the endocervical culture, it has a sensitivity of 80 to 90%. And because there are so many commensal Neisseria, there is normal flora, we have to use selective media, that is Thayer Martin media. Thayer Martin media is chocolate agar mixed added with antibiotics. So culture के लिए, in case of women, culture is preferred. The endocervical culture has a sensitivity of 80 to 90%. We use selective media like Thayer Martin medium. In suspected case of DGI, that is disseminated gonorrheal infection, if it's disseminated, if we are suspecting DGI, then in that case blood culture and synovial fluid culture is done in case of suspected DGI. Identification is required for species differentiation to differentiate between Neisseria gonococci from the other Neisseria species. So Neisseria gonococci, it is catalase and oxidase positive. It is both catalase oxidase positive. It ferments only glucose. Gonococci does not ferment maltose and sucrose. And automated methods such as MALDI-TOF can be used. Identification के लिए it is catalase and oxidase positive. It will ferment only glucose, and automated systems like MALDI-TOF is used. Molecular methods में we have PCR, okay, which is nucleic acid amplification test. Like PCR are available for detecting the Neisseria gonorrhoeae from the other clinical specimens, and this will target the 16S and 23S rRNA gene. Okay. So specimen, in case of men, urethral swab; in case of women, cervical swab. Dacron and Rayon swabs are preferred. Transport medium, Stuart's transport medium. Microscopy में gram negative intracellular kidney shaped diplococci are observed. Culture is preferred in case of women, so Thayer Martin medium is used. For identification, it is catalase and oxidase positive, ferment only glucose. Automated system like MALDI-TOF can be used. In molecular methods, we have PCR, which will target 16S and 23S rRNA gene.